If you want to function and perform at your best, you must first understand what the core is and what it does. The easiest and best way to think about the core is as a cylinder. And on the top of the cylinder, we have our diaphragm. On the bottom, we have our pelvic floor. And then surrounding, we have all of our abdominal musculature. Now, because in our society, we're told to suck our bellies in from a very young age, what happens is we adopt what's called an open scissors position, which is where your diaphragm and rib cage aren't in parallel unison, and instead the rib cage flares up and the pelvis tilts down. One nice visual to think about this is your body is a series of linkages, and all those linkages have equal pulling side to side. When we have one side pulling too hard, it can lead to a blockage or a restriction in those links, and then your body will compensate around the movement that's not happening. So even if you have a shoulder or a hip problem, you should be looking at the spine and the core first, because we look proximally first, and then that will affect everything distally. Once you understand how to regulate and control intra-abdominal pressure, then you can apply it to whatever exercise you're doing. Here we have a dead bug variation that's a great place to start. Next, you can apply it to some patterns like a squat, a hinge pattern, and then even take it to something a little more complex like a kettlebell snatch. This is one of the most overlooked and misunderstood areas of rehab. If we're going to get better at getting patients better, we first got to understand how these mechanisms actually work. If you like this content, make sure to follow, like, and subscribe for more.